Kei ngā huia kai manawa tēnā koutou. Nau mai hara mai ki Tapatahi. Welcome to the program and thank you for joining us. If you're watching TV or via our website, please let us know your thoughts on our Facebook page. Tapatahi is a special Māori television program that keeps you up to date with the latest information on COVID-19. Coming up on today's program, we talk to numbers expert Andrew Spall about his new app, which tells you what COVID-19 could look like for Māori if the pandemic was left to spread unchecked. He says 10,000 Māori could die because they're more vulnerable. And what is being done to support whānau? We speak with the coordinators of two testing stations, one in Whakatāne and the other in Kaikohe, and we show you what's involved in the testing process. And we talk to the South Island Whānau Ora Commissioning Agency about a survey that shows Māori and Te Waipounamu fear running out of kai, firewood and power. But first, here's what you need to know in 30 seconds. Well, it's day 13 in lockdown. There are 67 new cases, 39 are confirmed, 28 are probable. 176 have recovered, that's good news, which takes our new total of cases to just over 1,100. 13 are in hospital, including 3 in ICU, and 1 is in a critical condition. Nearly 40,000 people have been tested, and of the 1,100 cases, 87 are confirmed as Māori and 38 as Pacifica. The number of significant clusters, which are 10 or more people infected from the same place, remains at 12, after 2 new ones were confirmed yesterday. The Auckland Marist College cluster is the biggest, with 72 confirmed cases. The Prime Minister has confirmed that the lockdown will remain in place for at least the full 4 weeks, and surgical masks now have been ruled essential for workers in hospitals at all times. And Health Minister David Clark says he was an idiot to have breached lockdown rules by travelling 20 k's to a beach, which, as we know, whānau is not allowed. The Minister will keep his job for now, but has been demoted. And moving on to our first story, an app will be released today that will show us what COVID-19 could look like for Māori if the pandemic is left to spread unchecked. The app can be used on any device and is designed to show the projected number of Māori cases in each DHB region. Now, as you know, numbers are being shared every day by the Ministry of Health. The number of confirmed cases, probable cases, the number of confirmed Māori cases, and so on. But what do the numbers actually mean, and how reliable are the numbers? Well, joining us now is statistician and Auckland University lecturer Andrew Spall. Tēnā koe.
Ata Māori.
First of all, tell us a bit about this app. What can it tell us, and why is that information important?
This app is intended to do 2 things, but we're doing one at a time. Okay, the first thing it's intended to do is to put information into the hands of locals about what could be, how bad this epidemic could be in the regions. And that's because not only health services are delivered in regions, but our response as whānau, as hapu and iwi, is also regionally based. So we need accessible regional information. So that's enables people to have a look at, how bad could this be? Who's likely to be affected by this, based on the numbers of Māori in each DHB. The second stage of the app will then be reporting on that, on the progression of the epidemic at a DHB level, but again putting that information in the hands of people who can just make decisions locally. Because we need to get this information out of the hands of the numbers nerds like me. It needs to be accessible and usable by everybody.
Does that suggest then that the numbers, and we are getting a lot of numbers, right? Every day numbers are being shared with us. Does that mean that the numbers that we are currently receiving are not good enough?
The numbers are, or the data behind, the information behind the numbers is good, right? The problem is that the way the numbers are presented we aren't able to put that in a context that will inform local decision making. So if we have, say, the total number, like you've just reported, the total number of cases for Māori, right? Kehia, well, where are they, right? And that's important because if they're in Kaikohe, we need to know because it'll be the locals who will know about the whānau and about the local needs, right, in order to stop that epidemic in its tracks. If it's in South Auckland, it'll be different, right? So we need to be able to put those numbers in place, right? And place is really important.
It sounds like we need to provide a bit more detail behind the numbers. So while we can talk about confirmed cases, probable cases, etc., are you suggesting we need to know more information about actually what those numbers mean, where they are located, so that those within those regions can actually make good and informed decisions?
Yeah, that's exactly right. But there's a problem in that, because if you start to release a lot more detailed information, it becomes identifiable, right? So you'd be able to look at a case of say, oh, look, there's a 58-year-old Māori woman living in Kaikoui. Is that Auntie Mo, right? And chances are it will be, right? Because we know enough about our local communities. So we can't just put the data out there in that format because it becomes identifiable. So that's why we have an app which sits in between the really detailed data and the local community, because it makes the detail invisible, but it still makes it useful.
So what you're saying, if I can go back to what I said in the introduction regarding the worst case scenario, right? What you're saying is that if COVID-19 was left unchecked, we could see potentially up to 10,000 Māori deaths. Now, of course, we're not wanting to scaremonger or anything of the sort on this program, but I do want to understand how you've come up with that figure.
Right, we've come up with that figure by using some relatively simple modelling based on what we currently know about the epidemic. So it's a matter of taking into account what we know about the infection rate of the epidemic, what we know about the death rate for those people who get the infection, and what we know about the structure of the Māori population in each region. And then over the top of that, we put some historical information. I was brought up by my nan who told me horror stories about the 1918 flu epidemic. And the Māori death rate for that was about 7 times the non-Māori rate, right? And it depopulated rohe all over the place. But also the most recent flu epidemic, it was in 2009, had a fatality rate for Māori that was 2.6 times higher than non-Māori. So we can build that into our model in a flexible way. Say that if we repeat history and we have that level of inequity, we're in for at least 10,000 deaths. However, if we remove that inequity, right, and if the outcomes for Māori are the same, right, then we could actually save 4,000 lives at a minimum, right? And so that's a really good impetus for saying if we want to do save Māori lives, we need to move away from the one-size-fits-all response to this.
What is your data telling us about the most vulnerable within our Māori communities? Rangatahi, kaumātua, pakeke.
This one, the rangatahi looked like they might be okay in terms of bad outcomes, but rangatahi are really, really good at spreading this, right? And so we look at our model in three ways. Who's going to get who's more likely to get the illness, and then of those who are more likely to be hospitalised, and of those who are likely to have the ultimate outcome and die. What we do know is that we're much more likely to get infected, right? Even if it's just consider the size of our households, right? Currently, if my wife came home, she's a healthcare worker. If she came home with COVID, there'd just be 2 of us, right? We're empty nesters. But at my cousin's place, somebody goes in there with COVID-19, 14 people get it, right? So our larger households and the fact we're interacting more by sharing kai and supporting whānau means that we're more likely to get infected. Secondly, a lot of the age groups who are at risk of poor outcomes are already carrying levels of illness that result from long-term exposure to childhood illnesses and things. So our Pākeke and kaumātua with lung disease or heart disease are at risk of a really bad outcome, worse outcomes, but at a younger age. And then that is then reflected in terms of mortality. So what we're suggesting is on the basis of all of that is that we actually go hard at isolating our over 60-year-olds rather than the one-size-fits-all over 70-year-olds. And then that will also allow us to then focus on our 50 to 60-year-olds, and I'm in that age group, who have actually got pre-existing conditions. Now, that's different from the current Ministry of Health policy advice, which is the over 70. But also, implementing that means we need local knowledge, right? It's not the kind of thing that's going to come from Wellington.
And what you've just said, though, in terms of the discrepancy with the advice being shared by the ministry, for example, the most vulnerable are in the 70-plus age bracket. What you're suggesting is actually that is 60-plus for Māori, but even younger for those that have respiratory problems. Yeah. Are there any other findings that you have, as we wrap this interview up, because we are running out of time, are there any other findings, key findings, though, that you can share right now with our whānau?
One of the key things is you need to know your own community, and that we need a way to know where our at-risk populations are and do something for them at a local level, and not necessarily rely on a one-size-fits-all policy from Wellington. And I know some iwi like Te Arawa are already doing that, and all strength to them.
Andrew Spall, we thank you very, very much for your time. And obviously, when the app is released, we'll make sure that those details are on our website and on our Facebook page so that our viewers can check it out. Tēnā roa atu koe.
Okay. Noho ora mai.
And of course, that is Andrew Spall, a statistician who is releasing an app today so that we can better understand the effect and impact of COVID-19. Well, COVID-19 testing has ramped up over the past week with 3,709 tests carried out yesterday. But are Māori being left behind? Two iwi organisations have taken the lead to ensure Māori can and do access COVID-19 testing in a Māori environment. Whakatānes Te Puna Ora o Mātātua runs a drive-through testing centre and will soon go mobile to other communities. Ngāpuhi's COVID-19 response team also runs testing in the community, and the number of Māori getting tested in their rohe has tripled since they set up. Shortly, we'll talk with Dr. Chris Tooley and Tia Ashby, but first, here's a short video that shows the testing process.
Kia ora, how are you going today? I'm going to be doing your swab today, okay? So it's a nasal swab, so that means that it does have to go up your nose a wee bit, okay?
Okay.
But look, it isn't going to hurt, but it is a bit of an uncomfortable feeling.
Okay.
So some people find that it makes their eyes water,
okay,
or it might make you sneeze. So I'm going to grab you some tissues. You can hold on to those, okay?
Cool.
And then what I'm going to do is ask you to tilt your head back so that your chin's up a little bit.
Okay.
And I'm going to go in with the swab, okay?
Right. Okay.
I need to keep it in there for a good 5 seconds.
Okay.
So what I'll do is once it's where it needs to be, I'm going to start counting to 5 slowly out loud. All right? And all I need you to do is breathe nice and gently through your mouth.
Okay.
Okay?
All
You're
right.
good with that?
Okay, I'm all right.
Lovely. Cool. If you can just pull that down. Right, I need you to just tilt your head back a little bit more. That is absolutely perfect, okay? So I'm going to go in now, all right? And where I need to be. 1, 2, 3, 4, 5. There you go, that's all done. Well done. You did brilliantly there.
Thank you.
Cool, okay. That's me finished. Look after yourself.
Thank you.
All right, Ara, well done. Thank you for coming in. I think that's a good thing you've done. Now, the self-isolation business is the real deal, all right? So please take that very, very seriously.
Thank you.
All right, mate, take care.
Thank you very much.
And let me just thank and acknowledge Te Puna Ora o Mātātua for letting us show that video. Joining us now is Dr. Chris Tooley from Te Puna Ora o Mātātua and Tia Ashby, lead for the Ngāpuhi COVID-19 Response Project. Tēnā kōrua.
Kia ora, Shane. Kia ora, Shane.
Chris, let's begin with you. Why did Te Puna Ora o Mātātua set up the drive-through, and what need did you feel wasn't being met by you doing this?
Look, when it came to the testing station, we knew that it would be ground zero for this whole COVID-19. And so we set up the testing station, and then we had to quickly escalate to the community-based assessment centre after that. And our rationale was that basically one size doesn't fit all. Māori were being asked to go to the 0800 health line. They're being asked to the clinics, and Māori don't engage in that way. So if we knew that if we could control the testing station itself, would be able to provide it through a Māori lens, a kaupapa Māori lens, and then push out our comms into the communities through te reo, so we could get more engagement from Māori in that way. And the results so far haven't been that great, to be honest, because we're still working with a very fixed site at the moment. Everything's quite linear. And so that's why we've been pushing out to these mobile clinics, so we can get further into the regions and further into the communities, so we can really get that engagement up.
So what's different with the way in which you message the communications and with the service that you provide?
So our messaging goes out through social media. It goes through all different channels, through iwi marae channels. It goes through to the communities as well. We have our own 0800 number, and basically we didn't wait for a decision for us to do that. We just went live straight away, and pretty much we have about a dozen people around the clock monitoring that, and that answers any question related to COVID-19, not just the kind of clinical protocols that you get through Healthline, but all your hardship questions, all your kaumātua home-based questions, everything to do from electricity to kai, even in relation to the new policies around tangihanga and so forth. So it's a full wraparound service, and it's worked so well that even civil defence has come in behind our 0800 number now, and so is the DHB. So it's proving to be quite an effective regional approach.
You did touch on this earlier in terms of the response, and you said it hasn't actually been that great. So are Māori getting tested?
So at our testing stations and our assessment centres, Māori have been disproportionately unrepresented so far. We're not seeing too many Māori come through. That's why we've been working for the last 4 weeks to get sign-off to get a mobile clinics into the regions. And so we go live with koutou later on this week. And then we're up into Tūhoe next week. And hopefully we can start mitigating some of that access that hasn't come through yet. But even with us going live with the mobile sites, we're still predicting that we're going to be about 20% non-engaged still. And so we're trying to come up with another strategy that allows us to get into some kind of door-knocking campaign, so we can reach deeper into the homes and the townships. But again, we're coming up across a lot of clinical controls that we have to work through, a lot of operational controls, and it's taking its time. But 24 hours is a week, and we'd rather get in there today. But it looks like next week is when we get on the ground.
Why is this the case? Why are we seeing this lack of response from Māori, if you like, and not being engaged, not coming forward and being tested?
Look, they don't trust the system. They don't trust people who speak through clinical protocols. They don't. It's a very sterile clinical environment that they're being asked to go through. And so that was one of our reasons why we pushed out that video. It had over 10,000 views come through, and people sort of understood the idea of it's a pretty harmless process. And when you rock up, we have the first and last touch. We have whānau order at the front gate and whānau order at the end. So they understand the whole kaupapa Māori approach. But breaking down those barriers doesn't happen overnight. And just because we've got COVID-19 that's pushing through at the moment, it's no different. And so we still have to build those relationships, still have to build that kind of engagement to really reach out into the communities. And to be honest, we've only really had our business as usual engagement when we started these mobile clinics. And hopefully we can build on that in the next couple of weeks.
Thank you, Chris. And I do just want to pause there because I do want to bring in Tia Ashby. Tia, you've been sitting there and listening to what Chris has been sharing with us. And I'm wondering here whether or not a lot of what's just been shared resonates with you and the experience that you are having up north.
Yes, yeah, it definitely does. as soon as COVID-19, started to take a foothold in New Zealand, we knew that there needed to be an iwi-led response because not much was happening. There was, from my perspective, there was a lack of government consultation in COVID-19 planning with and for Māori. And as what's been brought up, given the history of the Spanish flu and the impacts on Māori mortality rates, we knew we had to just roll our sleeves up and get in there with a whānau order approach and coupled with digital and mobile solutions.
So what are you seeing and hearing on the ground? Are you experiencing similar things in terms of the lack of uptake by Māori to be tested?
So we've only been operating since last Friday, but no, we've actually had quite 80% that are coming through are Māori within the community. Where the last couple of days, we've noticed an increase. We're having up to 150 plus coming through the community-based assessment clinics. And what I'm thinking is that it's because the people they know, so it's whanaunga, that we've already established that trust and confidence with whānau. So, yeah, that could be one of the reasons why we could be seeing more.
So because they are familiar with the faces that are carrying out the testing, you think that is a possible reason for that rather significant uptake. Do you think also it's because of the recent New World kaikohe case that's been identified lately? And I'm asking that question because I'm wondering, do you actually need to highlight where cases are testing positive or where people are testing positive to help encourage our whānau to go along and be tested?
I think there should be, from my own perspective. I know there's some privacy reasons why they can't share home addresses or exact locations and patient names, but I think there needs to be more visibility on where the actual case is and where they're residing to give whānau more of an awareness that they need to be vigilant and, they need to isolate, and it's not a holiday period because it is what's been raised before. There are, it's not just a rangatahi, but there are still wanting to go fishing and congregate as if it's, just another day.
So that's another important issue, right, about this complacency or this complete not wanting to follow the rules. How much are you seeing of that up north?
It has been a bit of a concern. I must say now that the police have ramped up their presence within the community, not so much, but when we first set up the CBEC, we had quite a lot of interest, so people were coming to come and take a look, but we had whanaunga support, or we had kaimahi telling them, come on, whānau, go back home. It's not a time to congregate. This is serious. And I think it's having those strong communications throughout the community that's starting to hit home. And now that there is a confirmed case, people are starting to listen and stay home.
Chris, you mentioned before about your mobile clinic, which will be up and running shortly, and then also doing a door knocking campaign as well. What else do you think you need to be doing, or government indeed needs to be doing, for this message to register and for our people, for whānau to be coming forward and be seeking the advice and possible treatment that they may require?
We basically need a Māori version of Jacinda. To be fronting the daily news all the time, because all our comms is coming through Wellington and we're getting mainstream faces that are popping up all the time. We don't have a consistent national Māori voice coming out, and it's hard to connect. And And, just from, Mātātua, we're getting, overwhelmed with comms coming from the Ministry of Health, from DHB and from all the providers and so forth. So people are actually going through information fatigue at the moment. And so we need to get some kind of singular comms point going through. But, the reality is that we haven't actually focused on the most vulnerable population yet, and that's around kaumātua and how they access comms as well. We have over 500 kaumātua across the region that were already clinically vulnerable before COVID-19 came along, and we've got support workers there in the homes every day doing essential services. And we haven't had a strategy in relation to getting them tested yet into the testing stations. We haven't got a strategy to get them vaccinated yet. We still don't know how to get them from A to B yet. We're having quite a few conversations with the powers that be around clinical controls to allow that to happen. So there's still quite a bit of work to do right across the board.
So what's your message to those decision makers that are watching us this morning? What more help do you both need to be able to do what you need to do, and what you're doing very well, may I add? Maybe if we start off with you, Chris, and then we'll come to you, Tia.
I think we need to start diffusing the comms. I think there's a good national approach coming from Wellington, but we need a regional approach to comms as well. We need very clear, clean lines that are coming out. I think we need more resources in relation to boots on the ground, that sit in behind the mobile clinics. We need to engage the networks that basically whānau water providers already know and have. At the moment, they're only being mobilised through sanitation packs and so forth, but to be honest, they could be doing so much more if they were given the opportunity. So I think, I would use those two things.
Tia?
Yes.
What more support? What could change? What more support do you need?
What we're needing is, financial support to be able to fully realise the whānau water solutions that we're providing within the communities, especially around housing. We need assistance with finding appropriate solutions for whānau that are homeless or that are suffering from severe social issues at the moment that are forcing them into having to find alternatives. We also need to look at centralising the Māori health workforce and to be able to rapidly deploy them to different areas should they need to help other iwi hapu set up a similar format.
Can I take the opportunity to thank you both very much for your time this morning? Please also pass on our thanks to your wide teams who are doing great mahi out there, and I'm sure we'll be catching up soon over the next couple of weeks. Tēnā rau atu kōrua.
Kia ora, Shane.
And that, of course, was Dr. Chris Tooley from Te Puna Ora o Mātātua and Tia Ashby, the Ngāpuhi lead for COVID-19. Well, moving forward, employers are using social media and online tools to help kaimahi stay in touch with one another during lockdown. It's one way to help workers cope with the impact of COVID-19 and get through these very uncertain times. Here's Te Ao Māori News reporter James Perry with more.
Huri noi te motu ko whakakorehia ngā mahi hanga whare, ko here a ngā kaimahi ki te kāinga. Kaore tonu I te mōhio āhea hoki ai rātau ki te mahi.
I'm fortunate, I'm lucky I've got a boss that's, still, paying us, still doing it. And then I feel guilty, actually, to be real. I feel guilty because I have to justify that I do my job every day. And there's some of these guys out there that have lost their jobs and now they're freaking out about when's the next pay coming in.
Ko te online lunchroom I timatahia ai e mates in construction I te rā wiki. He pai e ahei ai ngā kaimahi ki te kōrero I ngā take e ngau nei I a rātau I tēnei wā o te noho here.
We're looking at all sorts of ways, video communications, and the smoko room is the biggest initiative to actually just bring people back into an environment where they feel they've got their mates around them, they've got that peer support, they've got somebody that they can check in with.
We did talk about the fact that some of us have that privilege of having a backyard that we can go to, and not many of our construction workers will have that ability to actually just walk outside and have a bit of space, and then they can call that free time.
Ko te noho ki te kāinga he ua ki te nuinga o ngā kaimahi. He ui hei Tā McFarland e mōhi wana rātau ki te hiranga o te tikanga rā.
Once you take that environment away from them and put them in an alien environment, which they are right now, it's almost to the point that they feel as though they're quite caged. It's almost an animal mentality. When anybody's caged up, they're going to try and find a way to get out.
It's the time more than ever to actually check in with your mates and make sure everybody is okay around you and that you're okay as well.
Ia rā ka tūwhiringa kuaha o te kaupapa nei ki ngā kaimahi e hiahia ana, ma te whārangi ipurangi mates, Irakati Net, Irakati NZ.
And of course that was James Perry from Te Ao Māori News with that report. And we're going to talk a bit more about this because the stresses that come with COVID-19 are taking their toll. Whānau have lost jobs, struggling to make ends meet, and they have fear and anxiety, they're in fear and anxiety about being thrust into 24/7 contact with those they share their bubble with. The government has launched a mental health campaign to help Kiwis care for their mental well-being during this crisis. But one psychiatrist, Dr. Diana Kopua, says a Māori-centred approach is what's really needed for Māori. Dr. Kopua joins us now. Tēnā rau atu koe.
Tēnā koe, tēnā koutou katoa.
What can we do to support whānau to help them cope during this time?
There are many angles to take how we support whānau. I think the first is to acknowledge that every crisis is an opportunity. And if we look at a bigger picture, so if we go whānau hapu iwi, we can actually see that there are iwi around the North Island, Northland, whānau Apanui, Te Tairāwhiti. We're looking at ways that we can support our people. So what we're at risk of doing is thinking of things at an individual level, and that's been our problem for too long now. Remember, Shane, we were in crisis before COVID-19. The systems were determined to be institutionally racist, and although the leaders in the ministry knew that, they were not sure how to operationalise that. And just listening to some of your callers before, that's the problem here. They don't know how to target and prioritise the inequity for Māori. So you need to be able to not just look at it at an individual whānau level. All of the mental health campaigns that will be rolled out will be based on Western knowledge, Western constructs. When you and I both know that there are Indigenous ways of understanding distress, there's a whakapapa of emotions, there are Indigenous healers out there that are giving freely of their resource online, but they're not getting a look in our mainstream systems. So that's one big picture. And I don't know if you want me to carry on, but at an individual level.
What I would say is that you raise a number of very good points. And I suppose if we go back to your first point, which is pre-COVID-19, Māori, whānau Māori, hapu and iwi, we're already facing a number of day-to-day challenges. And now we have COVID-19. It's what exacerbated the problem?
Absolutely. The problem's not gone away, and it is exacerbated. And I liked your wording because they have a number of challenges, and those challenges, as I see them, are the systems that we have an interface with. The correction systems, the health systems, the education systems, they're all in trouble. ACC is broken. They are not getting good outcomes for our people. So it's one thing for us to put our hands up and encourage our whānau to put their hand up when they need help. But what pathway are we expecting them to follow? Because at the end of that road are systems that are not doing well by us.
So what advice do you have for those mums and dads at home now, tuning and watching this, who some I'm sure are aware of those challenges, the systemic challenges that you talk about. But what is something that they can take away from this discussion that is going to help them move forward or try and tackle some of these challenges?
Let me talk directly to them as if they were in the room that I'm in wānanga with them about a problem. Whānau mā, you are enough. You're born from ancestry that was amazing, absolutely amazing. And for too long, we've been seen as operating as if there's something wrong with us, as if there are genetic flaws in our makeup. And what I would love for you to do is be able to tap into some of those live resources, like look at the maramataka Māori living by the Māori moon, look at Ricky Solomon and Rereata Makiha looking at the maramataka, look at Rangi Mātāmua and the stars and how to have a relationship with our environment. Look at Matatini extraordinaires. I asked my husband, who are the Matatini extraordinaires? And because he's a judge, he said the judges are. But you know what? I think we all are. The kapa, all of the kapa around the country are singing about our ancestry, are singing about our pūrākau. If you join us on Wednesdays on Facebook, Mahi a Atua, we are just normal people, artists, professionals, offering our opinion, things to do that help us connect with our ancestry. They're really important. Stop pathologizing. And what I mean by that is stop looking at our problems as symptoms. I'm not sleeping, so I must be depressed. I'm suicidal, so I must be depressed. In fact, connect with your environment. Connect with so many gurus. The thing about our social networking now is that we have the opportunity to show our magic. And it's not like the university system where you get a degree and then you have the ability to help our whānau. It's not enough. It's not working. We're enough.
What a lovely way to end this conversation. Dr. Diana Kopua, tēnā rā atu koe. Thank you very much for your time. And we really do appreciate your words of wisdom and your messaging to our whānau today. And tēnā rā atu koe.
Kia ora.
What a wonderful message to be sharing this morning. Well, moving on to another great message that will be shared by our next guest, I'm sure. Anyhow, let's introduce her. Māori and Te Waipounamu fear running out of kai, firewood and power. Fear it, according to a survey by South Island Whānau Ora Commissioning Agency, Te Pūtahitanga o Te Waipounamu. 45% of respondents say their kai won't last 4 weeks. 1/3 reported feeling unwell in the last week, and others were anxious about going out to the supermarket for fear of affecting people at home with respiratory conditions. With me now is the CEO of Te Pūtahitanga o Te Waipounamu, Helen Lay. Tēnā koe.
Tēnā koe.
Tell me, what are you doing? What is Te Pūtahitanga doing to support whānau?
Well, the first thing is to listen and to be there. And I think Andrew Spool said earlier in the show, we need to know our communities. And for us, it was really important to hear what whānau were going through. So we set up an 0508 for Manaaki helpline and also a survey to try to find out what the real needs were. There's no point just putting together care packs if actually what you want is firewood. And so we went across to Waipounamu. We've been really lucky to have the support of the 9 iwi who have been actively promoting the survey. And from that, we've been able to get a sense of what it is that they need and what it is that they're experiencing during the COVID-19 pandemic.
So what have whānau told you? And obviously I mentioned some of those things, some of their needs and some of their feelings in the introduction. But what are the key things that you've received or you've found out?
I think the overlapping layers of disadvantage have been a particular issue. So we'll have somebody who's a young mum who needs to get new nappies, who has a child who is asthmatic, who might have their nan living with them, who has a respiratory condition, and they're nervous to go out of the house. We'll have somebody who, the breadwinner, has lost their job, they have no money left for petrol, they're not able to get to the supermarket because they have rising rates of anxiety. And so what we're seeing is that this is not just an issue of not enough kai or not enough medication, it's often all of the above. And for many of our whānau who have come to us, you know, they've said, I'm proud, I don't ask for help. I've never had to do this before. And so our message has been koe e wakamā. You know, this is about all of us are going through this the best we can, and together it's about wrapping those arms of manaaki around one another to do, as Diana said, we are enough. We are able to respond to whatever the pandemic throws at us if we have that sense of whakamaungatanga, that sense of manaaki. That means we keep strong, we keep healthy, we stay at home, and we make sure that our bubble is self-contained.
It appears there is some need, some great need, if you like, in Te Pai Pounamu. My next question, I suppose, is around being able to meet that demand and being able to meet that need. Do you have the resource to be able to share, to be able to meet that demand and need?
First of all, we were able to invest in a people resource. So we received $3 million from the government, and that was part of the whānau order funding that came out 2 weeks ago. We've been able to immediately create 25 manaaki navigators whose role is to be there with our whānau to provide a listening ear, but also to go out to get prescriptions. We've set up a manaaki support team, which is to immediately provide food, petrol, power, data, but we also have a high intensity triage focus, which is about referring on to specialist mental health support, if the case might be, or to our whānau order navigator, our Nav Nation, our network of navigators, so that every whānau that goes through for help is able to come out of it with a plan to be self-determining, to do what it is that they need to do in order to get through this.
You've mentioned, Helen, quite a number of times manaaki. I understand hashtag Manaaki20 is also a campaign that you're running. Now, I understand we have a clip that we're going to play now, and then we'll come back to you so you can explain exactly what it's all about.
Yeah.
That's the most important thing I learned today. Just about washing the hands is going right up the wrist, but then it's actually about drying the hands properly.
Just tomatoes, whatever you can use really, water bottles, fill them up, stones, you name it. If it weighs anything, put it in your bag. Go tirohia!
So tell us, Helen, what is hashtag Manaaki20?
We were really clear about the psychosocial impacts of being in a lockdown process. And so to combat a focus on COVID-19, we're talking about Manaaki20. What is it we can do now? So hashtag Manaaki20 is about bringing on the world in terms of ideas about how we can be enough. So we have recipes for bacon stew, how to provide marakai, be part of a boot camp, do fighting to new music, self-care, learn more tirohia. And so the whole process of having the live wall on manaaki20.org is really to provide an avenue, a platform, particularly for rangatahi, but you'll be surprised how many of whānau are keen to share their ideas about how they're using isolation as a process for creativity and being able to make themselves stronger in that process.
You've also pulled together a team of rangatahi, and I do want to talk about rangatahi very briefly because I know we're just about out of time, but what are you trying to achieve there by bringing this group of rangatahi together to reach out to other rangatahi?
So we know the highest number of people with COVID-19 in Aotearoa are the 20 to 29 age group. We have to focus on that target group. They're champions for their whānau. They have great ideas. So what we're saying is how can you influence and be a champion for your whānau to get the message through about staying home, staying safe. So our rangatahi become ambassadors of the message, and we're actively employing them to be able to promote those public health messages about keeping ourselves safe.
What a great idea. Helen, thank you very much for your time this morning. We do appreciate it, and please pass on our thanks to all your team for the great work that they're doing.
Kia ora.
Tēnā koe. Helen Lay there, the CEO of Te Pūtahitanga o Te Wai Pounamu. Now don't forget whānau, we've launched a competition where you could win $1,000. All you need to do is create a 5-minute video that shows the motu, what you're doing during lockdown. And of course, it must be fun. Whānau fun. All the details are on our Facebook page or māoritelevision.com. We'll announce the winner at the end of lockdown. Kāti e mihi ana ki ngā waha kōrero katoa I whakawātea I a rātou anō ki a tātou I tēnei rā. Tēnā koutou I te rangatira o ngā mahi e mahi ana o tirā mo te oranga o te iwi whānui. Koe nā tapatahi mo tēnei rā kia piki te ora, te kaha me te māramatanga ki a koutou katoa, hei ko nā mo tēnei wā.